My name is Pam, and I am so excited to be with you today to share with you information on structural energetic therapy techniques and training opportunities that have totally transformed and expanded my life. It's been such a joy and an amazing journey working with Don McCann in his set training classes for over 12 years, watching the students grow and develop and become so excited with all these amazing techniques that they're learning. It's also an honor to be a part of this structural energetic therapy program as Director of Education. And I also am so happy to have my own private practice where I see miracles every day and such amazing, life-changing, long-term results with my own clients. Now, these revolutionary techniques of structural energetic therapy were developed and designed by Don McCann, and they are unique to structural energetic therapy alone. No one else is teaching these techniques, and no one else is doing these techniques unless they've been trained by us. What sets structural energetic therapy apart from all other modalities? The cranial structural techniques, not to be confused with cranial sacral, specialized soft tissue techniques, and specialized energetic healing techniques. Now let me give you a little bit of foundation information for the one-year training. We are all born in a core distortion, which is also referred to as a spiral or a twist. We saw this forming in a 16-week-old fetus at the Bodies exhibit, where the iliums were already beginning to rotate, the sacrum was starting to tilt, and there's a little tiny scoliosis beginning to form. So this is formed well before you're born. Now, many professionals have seen this distortion, and they also feel that they have released it. However, no one has been able to release the instability of the pelvis. Now, the cause of that instability is the weight-bearing separation between the iliums and the sacrum, which creates a lack of structural support, weight-bearing support for the pelvis. Now, this core distortion is evidenced by an anterior-posterior rotation of the iliums and a tipping of the sacrum. That's the instability of the pelvis. When the sacrum is tilted, the spine does not have a level base, so scoliotic curvatures begin to form, and that's the basis of most scoliosis. Now, in the body, when the core distortion is felt in the body, you have a long leg, short leg discrepancy, you have imbalances that are from head to toe, you have strains and weaknesses throughout the whole body. In the life process, as you have traumas happen, accidents happen, injuries happen, even emotional calamities happening, your body falls further into this distortion, and that's when you experience the pain. Now, there is also a distortion in the cranium. The cranium relates directly to the pelvis. This is where the cranial structural core distortion releases come in, and this is the golden nugget of structural energetic therapy. As we are releasing the distortion from the cranium with the cranial structural core distortion releases, we are releasing the soft tissue restrictions that are holding that distortion, moving the cranium into balance, which allows the pelvis to move into balance. The iliums move out of their rotation. The sacrum moves into an upright position. Then you have the stability in the pelvis. Now, as the sacrum moves into an upright position, the spine also has a level platform, so the scoliotic curvatures can begin to normalize. Never before was this able to be accomplished. This is the golden nugget of structural energetic therapy. Now, the other exciting things about this is the fact that when you release the soft tissue restrictions in the cranium, those restrictions can never reform. So the core distortion is gone. It's gone from the cranium, it's gone from the body, and that stability in the pelvis can never come undone. How exciting is that? How exciting would it be for you to experience this in the set trainings? You can get rid of your own pain And then you can pass on these techniques to your clients and get them out of pain long term. But this is only the beginning. After you release the core distortion from the structure, you have the holding patterns within the soft tissue. So Don McCann has developed specialized soft tissue techniques that have specific sequences of application of the strokes for the head, neck, and shoulders, pelvic balancing, and the thoracic. Now, we always work from the client's most acute area of pain first, and then we bring the body into balance to support those changes. As the body unwinds from the core distortion pattern, it tends to move through sub-patterns. Now, in each sub-pattern, there is a cranial structural restriction. We teach you the release for that cranial structural restriction. There is a soft tissue protocol, and there is an emotional component. You learn how to release all of those. And Don, with his experience as a licensed mental health counselor and a massage therapist, brings this dynamic aspect to this training. Now, he teaches all of these techniques within the scope of the massage therapy license. Now, at the very end of the training is when we introduce the intraoral TMJ. Why at the end, you say? Because if you have this distortion in the cranium, there's going to be an imbalance in the TM joint. If you have a distortion throughout the body and the hips are not in balance, they relate directly to the temporal bones. The temporal bones are still not in balance. So it's really necessary to bring the full body into balance before you start releasing some of the fine-tuning of the TMJ. And as a matter of fact, most people who come in with TMJ concerns at the beginning of their treatment have those symptoms disappear as we balance the body. Usually we use those intraoral techniques when somebody has had facial surgeries or a lot of facial trauma. Now, as you can see, we work with balancing the full body, and with the releasing of the core distortion from the full body and establishing the support within the pelvis. Imagine the possibilities. Now, there is one more technique that Don has just added to the set training that is phenomenal. This is the frontal occipital decompression. He developed this when working with his autistic children and had amazing results with them. There is a video on that, so you can look that up. But we have seen so many more applications that are just as amazing. Early onset Alzheimer's clients who couldn't drive themselves to the office, who couldn't remember when their appointments were, and who were kind of fading from life. After a few applications of this frontal occipital decompression, they're now back driving. They're now back in their life activities, and they walk in saying, I remember the little things. How exciting is that? What a blessing. We hear so much about concussions with children in sports now, and we have actually had clients whose brain function has been impaired by the scar tissue from so many concussions. The application of the frontal occipital decompression has actually reduced that scar tissue, and the brain function has returned to normal. It's also a brain detoxifier, it's a body detoxifier, helps to bring the whole body into homeostasis, and I don't think we have really realized all the applications of this at this point. This is one of the beauties of structural energetic therapy. It is ever evolving and ever expanding to meet the needs that come into the office. Now, we have the set training set up in either one weekend a month for 12 months or 4 days every 2 months for 6 sessions, and that way travelers don't have to travel 12 times a year. They can travel just the 6, so it's perfect for them. We also have very small classes, maximum of 12, and that's with Don teaching, my assisting, and at least 1 or 2 other assistants, so that we have personalized, hands-on, individual supervision in every training class. So, doesn't this sound exciting to you? Wouldn't you love to give this gift to your clients? Imagine how they would feel about you if you can release their pain long-term and get them back to normal activities pain-free. That is the goal of structural energetic therapy.